So while new infections are down, it's hard to know if Omicron's spread is actually slowing because testing is scarce and prioritized for at-risk Ontarians. But one Niagara MPP is saying there is a homegrown option that could help provide more results. Last week, Ontario's top doctors said the province is in a tough spot. There's too many cases of COVID and not enough tests.
Right now, given the high community prevalence of COVID-19, testing is a luxury.
Norgen Biotek, a testing manufacturer operating in Thorold since 1998, says it can help make tests more available. The federally recognized company sells same-day or next-day PCR tests for asymptomatic people in Niagara region and have huge contracts, primarily in the U.S.
During the peak of COVID, we were doing between 500,000 and 1 million kits per week, and all of those were going to a U.S. military-funded contract.
Local MPP Chief Burch is trying to get the health ministry's attention. He says the Ontario government has resources in its own backyard.
I have a 13-year-old and online learning right now, but going back to school next week, and we're being told there is not the capacity for testing. And here we have this great company that can test thousands of people and produce thousands of kits.
To see the government put out articles and media and this messaging that there's PCR test shortages, when the reality is that that's not true. There's just a shortage of free PCR tests.
Norgen says its lab can analyze 10,000 tests a day. To do so, the biotech company says it'll need some government help. Currently, it's only allowed to test asymptomatic people. The company is hoping it'll get approval to test symptomatic people as well. Second, Norgen wants to work with the province to increase free testing capacity.
We're really hoping to just get exposure out there, whether it's hopefully that the government, which is what I think, they should be paying the facilities like Norgen to do the work and giving it to the people in the country for free. I mean, it's not our fault that they don't have the laboratory setups.
So far, no talks have started.
We're puzzled as to why the government hasn't reached out to them. We made the ministry aware in December.
Have we reached out to the health minister's office, who then forwarded our inquiry to public health? We have not heard back from them yet.